What's up? What's up? All right, what are your guys' questions? I'm gonna get started. So, it's been a minute since I've been on. I am on here and YouTube. So, if I'm going back and forth with questions, just let me know. But welcome, guys. It's been a minute since I've done this, but if you guys have questions, like I said, thank you. Just feel free to type chat. I feel like I want to be super productive and helpful for you guys, um, and give as much feedback and support as much as possible. I will probably do a case study because I'm going to have professionals and regular folks on here too. So I will choose someone at the end of this who wants to jump on and contribute professional wise as well as a patient. If you want a free consultation, I'm happy to do that as long as you're okay with an audience being available to view what's going on. So you can get live feedback from me in that regard. But then again, like I said, I do have a professional audience as well. So there are going to be people on here that may be asking questions that you have no idea what they're talking about, but it's completely okay. So, with that being said, my name is Amaju. Amaju, if you guys never knew how to pronounce it, Amarua, and I am an esthetician as well as an RN. And I am finishing off my nurse practitioner program. So, it's been a long 3 years. I'm studying family practice right now. So, running between the clinic, the hospital, doing, stuff all over the place to pretty much better provide for you guys. That's the whole idea behind what I'm doing. Previously, I've had like two different lives. So if you didn't know, I studied business before. So I had a career before I started medicine and aesthetics. I studied business. I was a makeup artist, and I did marketing. So in that sense, I went to UCR, got my BS in business administration and entrepreneurship. And then I went to Pepperdine and got my MBA in brand marketing and international studies. And during that time, probably towards my like the beginning, first 3 months into it, I was like, yeah, this isn't for me, but I'm already taking the student loans and studying the program. So let me finish it. So pretty much what I did was I started applying to PA school. I started, trying to study to see if I wanted to be take the MD route. I also applied to, all my prerequisites to kind of cover everything. So I casted a wide net, whether it was RN, NP, or MD. I was taking prerequisites. While I was also in my MBA program, I also enrolled in esthetician school. So I was at Citrus College. Once a week, I was driving out to Malibu or West LA to take my MBA classes at night. While also, I think I was working too. I was working as well in LA. So during that time, it was just like a period of discovery, honestly. My MBA program was probably the most challenging for me just because it was an environment where I felt supported, but it was also a period where I didn't even know what I wanted to do exactly or if all the risks were worth it. Girl, I was in 7 different schools, community colleges, just to get my prerequisites done in time because I knew that I didn't want to waste any more time just floating around. So I was in 7 different programs, failed some classes, jumped to a different school to try and figure out how I can get that anatomy or physiology class done, jump to the next one, how I can get genetics and, all the different classes done. I applied to PA school, got denied, probably 2 rounds, which is like 2 years of cycles. MD, I was like, yeah, I'm not taking this MCAT. I'm not trying to study this hard. But there's no shame in that at all for those people who are interested in the MD route. And then I applied again to PA. I applied again to RN school, and it ended up being that I just got into an RN program. And I do not regret it just because I love the support and firsthand experience that you get to be with patients, and whether you're in, medical, surgical, ER, psychiatric, you're really working with the patients on the day to day, and you're pretty much the eyes and ears for, the advanced providers. So I got my esthetician license within like 7 months, and then decided to work at a medical spa as well as a plastic surgery office. I also, what else did I do? I did that, finished my prereqs, and then got into nursing. So while I was an esthetician, I was also, in RN school as well. It was a rough road, but I finished, and then now I'm pretty much here. So if you guys have any questions about my journey or support, because I know a lot of my employees are now in nursing programs, which I'm really happy about, or people are just looking for support and questions on that. Yes, grinding girl. Let me know. Monique is an amazing esthetician. She is on the LA, deeper LA side, but she's amazing. We'll have her jump in the call. So let me know how long you're on here. We'll try and get you on to kind of discuss like your journey, your experience, as well as any tips and tricks for people. Oh my God, yes, I forgot. I started off doing lashes. That was a grind, I was really good at it ish. I don't know. That's subjective, but I started off with lashes, and it took a minute for people to trust me with their skin, but I studied my ass off. I invest so much money, so much time. As you can see, I am studying even more for skincare. I'm always mentoring. I'm being mentored. I'm hitting up Monique. I'm hitting up people. You don't look like a mess. You always look good. This girl looks amazing, amazing, amazing. But anyway, yeah, like I'm always investing into my education. I think the biggest thing that I tell people is like, hey, I am always reading, academic journals to really discover, what's the latest trends that's evidence based that are really transforming people's skin, as well as off-label things that aren't really marketed online but are really creating benefits for people. Long and the short is, dermatology has had a pretty I would say white dominated field. Even when tretinoin was being discovered, they were illegally testing on black and brown prisoners at the prisons, trying to see if it would work or not. So, and most of the dermatologists way back when were predominantly white. So there's a lot of great people in this industry who know skin of color. I think I am one of them, but I don't classify myself as an expert. I do not have a medical director type of degree, which, those are technically the experts, as well as, the cosmetic chemists who really test and know the ingredients that are being put into these formulas that we're using on you guys. But I would say that I am pretty knowledgeable about it. I did have a little experience working product development, but it was ghetto. I realized really quickly that the brands I was working with did not put the customer first. And that's the whole aspect of why I got into being an esthetician and being a nurse, because I got tired of, you know, um, not being hands on with people anymore. And, you're trying to work on the bigger scale of things to impact the community and support their skin and their health and whatnot. But at the end of the day, we live in a capitalistic, economy. So it is what it is, right? Oh, your chest improved so much. It's like new. Thank you so much. You're so welcome. Yes, 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 yes. I trust you too, Monique. But yeah, Monique is amazing. She does her own skincare. We've done injectables. We've done neurotoxins. We've done threads and all the fun stuff. But I guess enough about my journey. But I think that what I really love to do in my practice is pretty much acne. I work with acne like crazy. Pigmentation, I love to be challenged in that sense, as well as scar revision. But I do know my limits. I pretty much refer out if it's something that I really can't handle. Um, what else do I do? So the modalities that I pretty much use are chemical peels. I'm really good at chemical peels. Um, lasers, really good with microneedling. Um, what else? Regular facials, diamond glow. So that's hydrating dermabrasion. If you think of a hydrofacial, that's pretty much the same concept. Um, what else? Yeah, if you guys think of anything that I've done on you, kind of let me know. Um, Rachel, you did DM me, so make sure to ask your question at some point so I can answer it. But let's get right into questions. So, like I said, acne, pigmentation, scarring. If any of you professionals out there have any input or people who really want to get into the industry, I know a lot of RNs hate me all you want, but we really don't have skin experience. We are being taught the basics of how to stage a wound, how to address a wound change, and things like that, but you really don't know skin. And when you get into this industry, you're mostly being trained by brands, which they're brand driven to support their business model, right? So you got to be skeptical and question things, but you also got to be understanding. I am still in Rancho Cucamonga. I'm in Rancho Cucamonga in Beverly Hills. What else? Pigmentation. I What do I do for pigmentation? I do everything for pigmentation. But anyway, let's get some questions going because I can just talk nonsense all day. It's the ADHD in me. Um, but let's see. I know some people had questions in regards to, yes, the one-on-one class really helps you think beyond the surface of the skin. That's completely true. I used to do trainings, and it just became a lot just because you guys know I'm running 2 offices. I'm in nurse practitioner school and also working at the hospital. I got clinicals that are like it's like free labor. I'm working in the clinic all day as well. But those are the best things to kind of invest in as well and make sure it's someone reputable. A lot of people are trainers now, and I knew I didn't want to market myself as that. So a lot of people still ask me for training. I still do it case by case, but I'll probably bring that back once I am done with school. But yes, one-on-one training is good. Just make sure you're vetting someone who really can talk about the science of something, break down the rules, and then show you how to break the rules to really transform the skin and be able to continuously tell you the reasons why each approach works and the mechanism of action. What do you recommend for cystic acne? So, cystic acne can be complex. So, what I always tell people first is you got to understand what your triggers are. Did it come out of nowhere? Did it start at a certain age group? Did you have it when you were younger, or you have the predisposition for it, genetically in your family, things like that? But most of the time, women, especially women, you're going to have hormonal acne at one point in your life, whether it was when you're younger and it comes back later in life, perimenopausal or menopausal, or when you're starting to have that decline in your hormones after about like 35 or so. So, when it comes to hormonal acne, you want to make sure that you are understanding if you are on anything that's manipulating your hormones. So, I always go over birth control. I go over from if I do head to toe, I have to be systematic. So, from your head, I ask you if you're on any medications, if you have any mental um, health conditions where you're taking certain medications that can manipulate things. I talk about if you've had any, infections in your mouth. I also talk about your gut health. Do you get gassy or bloated easily? How many times in a month do you have any food sensitivities? Are you regular with your bowel movements? Because part of that process of getting rid of excess estrogen, testosterone, and all of that is through your bowels, making sure that you're regular in that sense. So if you're constantly constipated, you're going to have hormonal imbalances that also reflect on the skin. Same with your liver. Are you an alcoholic, or you drink too much, or you have that predisposition where everything is a little bit sluggish, where you need to optimize it? Those are things that are going to play a role into your hormones as well. I ask you about your cycle. what's regular to you. Do you have a OB-GYN on, your Rolodex that you try and see at least once a year, as well as a primary care physician that you see? What are your eating habits? Um, if you're sleeping, how often are you sleeping? Do you wake up, throughout the night, or do you have restful sleep? Do you work out? What does working out look like to you? And then we talk about all the like little things that can kind of add up. My biggest thing is iodine. People don't realize how much iodine is in our diet in excess, especially through supplements. So, hair, skin, and nails. It's kind of cold. Hair, skin, and nails. Um, if you're taking B12, that can cause monomorphic acne that is just all over your face, comes out of nowhere. Same if you're taking whey protein and you're working out, you're on your fitness journey. Some people get away with really good protein, or you go plant based. Some people get away with some whey proteins and they're acne prone. So it all depends. Like for me, I researched this brand called, what is the brand I use? Levels Whey Protein. Most people can't have it, but it's grass fed, it's third party tested, there's no heavy metals and things like that. What they say is the exact amount that you're getting inside of that powder, and it's a pure form. So I don't break out as much anymore, but I figured out my other triggers were chips. I can literally eat a bag of chips every single day. So I had to slow down on that. I used to look like a little cratered cheetah, and it would just exacerbate, go down. So those are things that can trigger it, as well as the biggest one is stress. So when you're looking in the mirror, you're critiquing yourself, you're stressed out. Your body doesn't know the difference between good stress or bad stress. You can get married, you can have a baby, you can move, you can get a promotion, get $1 million, whatever. Your body is still gonna go into fight or flight mode just because it's in a different state of homeostasis, right? So it's supercharged, your hormones go a little bit higher, and then you start breaking out a little bit more. Most times people think it's just when it's like devastation, when it's something bad is going on, but it could be good change, and you're just like, where are all these pimples, coming from? It's like when you're excited or you have an event going on, right? And you're just like, why are my all these pimples coming through? And I always have something going on. So things like that you have to consider with cystic acne, but I'll circle back to that. How do you feel about beef organ supplements? Beef organ supplements, depending if it's like liver, actually has high iodine in it. Usually with my patients, I will give them an iodine chart, and it will go over things that are dominant. If you, the professionals out here, I know, I'm sure you know it from Face Reality, from Vivant, if you've done Dr. Fulton's training, things like that, they kind of go over those things, which is like supplements, like I said, it's like liver. If you're eating out a lot, it's the salt. If you like sushi, it's all of those seaweed, seafood based, the bottom feeders, crabs, scallops, peanut butter, those nuts type of oils, dairy. Dairy is a big thing just because sometimes those cows aren't grass fed, and sometimes those cows are being pumped with hormones to produce faster, and you don't think that you're absorbing what hormones they're being pumped with. So you got to think about all of those things, especially with acne. I always tell people that just to cut dairy out, but that doesn't mean that you can't have pizza or you can't have whatever. It's just like, don't be downing milk like crazy. Or if you know that you're a Starbucks addict and you love a frappuccino every morning, I mean, you might be breaking out because of that. What else? So we answered Rancho. I am in Rancho. Treatment of sebaceous hyperplasia. Usually there is cauterization. You can freeze it off, things like that. You have the potential of it to come back. Um, what depth do you find most success when treating pigmentation on high Fitzpatrick's? Um, can you elaborate on that? I'm gonna have you, let's see, can you come on with me? I'm gonna have you jump on and ask me. Oh, in regards to microneedling. Um, okay, so when microneedling and I'm working on darker Fitzpatrick, what she's asking is microneedling, usually we're doing a depth between 0.25 all the way up to 3. 3 is when you're usually doing body. You can kind of get away with it when you're doing scars, really heavy scarring. I like to do, if I'm doing combination treatment, so microneedling with a chemical peel on darker Fitzpatrick's, I'm only going at a depth of maybe zero point zero 0.05 or 0.075 just because you're already creating the microchannels and then a chemical peel is usually mild to moderate depth within our scope, right? Mild to moderate depth. So you're combining those together, that peel is going to go way deeper. And so we don't want too much heat in an inflammatory process too deep. And when you get it too deep, you're getting past the DEJ junction, you're getting past the DEJ junction, and usually that's not where pigmentation is, but we're starting to see a lot of people have melanocytes right at that DEJ junction sitting on top of that dermis. And that's almost like where a tattoo is, right? You can't bleach a tattoo, you can't chemical peel a tattoo away, right? So you want to make sure you're at that depth and it's still going to do its job. I promise it's still going to do its job, but you don't want to go deeper than that when you're microneedling doing combination treatment. Hope that answers your question. I have a hard time treating PIE. Sometimes, how do you address it? I love um, write this down. This is Skin Deep by Autumn. Write this down. I love Skin Recovery Peel. Skin Recovery Peel by Aesthetics. It has mandelic acid, it has salicylic acid, it has azelaic acid, it has retinol in it. Those are a powerhouse. I did a Russian, I did a training for acne, and that has been my go to for PIE. Also, um, just in general, I would say salicylic acid, retinol, azelaic acid. If you can find peels that have those combinations in it, those are the best one because you have the inflammatory process. So you want to bring that down. Azelaic is anti-inflammatory. You have the retinol, which is cell renewal. So it's pushing everything, all the pigmentation is at different layers to the surface and off. And then you also have salicylic acid that does the same thing. And then if you have a brightener in it, azelaic or even like the DSE mask by Aesthetic, you has kojic acid in it. It's pushing pigment. And when you have retinol and a brightener together, the retinol is carrying that brightening molecule deeper down. So you can microneedle that into the skin. You could use it as a mask from 15 minutes all the way up to 12 hours. The longer you leave it on, you have to understand that because of the ingredients in it, the quality or the percentage of salicylic and retinol in it, you're going to have a higher inflammatory process. So people's face can get swollen, they can wake up with their eyes swollen. So it's something that you need to slowly get into when you're treating PIE. PIE can also be treated with, like I said, like a peel microneedling, a chemical peel by itself. You can do lasers, so vascular lasers are really good for PIE, depending on your scope. I think you're an esthetician in California. So you can do chemical peels are going to be the base thing. And then I always tell my patients 70% of your results are going to be coming from your home care. I can clear you and have magic on you, but if you are not doing what you're supposed to be doing at home, it's not going to work. And as we know now, which I've been saying from the top of my lungs for the longest time, tinted SPF, iron oxide, zinc oxide, they will make or break your results, especially if you have acne, PI, active PIE, and active PIH, or some type of pigmentary disorder. You want a tinted SPF. For those who don't know what I'm talking about, there has been studies that your body is your melanin stimulating hormone is reactive to the sun. And sometimes it goes into overdrive, especially when you have active pigmentation, to produce darker and darker pigment. So you're kind of like fighting a battle. You're investing all this money and time into like treating and treating, and then you're going out with like a regular sunscreen. Don't get me wrong, it works, but when you try a tinted, when you have active pigmentation versus a regular one, you're gonna see your skin is like glowing brighter than you can even imagine. And I've done all the tests on myself. Trust me, I've done it all. Um, what do you recommend for rosacea? So rosacea has different mechanisms of action. This is for Jen. When it comes to rosacea, one, it's inflammatory disease. So I always go over with my patients, what are your triggers? Do you notice you get more red when the weather changes, super hot, super cold? Do you work out outside, windburn, that type of thing? Um, do you drink a lot of hot drinks? Do you drink a lot of caffeinated drinks? Do you drink alcohol, really, really spicy food? See if there's a dietary aspect with that. Then I also discuss the mechanism of action. So I tell them in a appropriate way where you're not inundated with so much science talk, but there's an aspect of inflammation. So we're using ingredients to bring down the inflammation. So hydrating as well as retinol. Um, as well as the Demodex concept. So what is that? It's pretty much like a parasite. Everybody has them in their skin, lashes, things like that. When you a byproduct of the Demodex is inflammation and redness because they feed off of your oil. So if you take away their trigger and control your oil, you are going to control your rosacea. So usually what I have people on is things with salicylic acid. Benzoyl peroxide is very anti-inflammatory, maybe a retinol at some point, but usually salicylic in the morning, benzoyl peroxide at night. You need a lot of antioxidants because your reserve of antioxidants that help to strengthen your skin barrier is depleted. It's constantly in an inflamed state. So your body is trying to put as much antioxidants in this area of your face to heal it, but there's not enough. So, antioxidant rich moisturizers or antioxidant rich hyaluronic acid is my favorite thing to do and add into the routine. Will really help strengthen your skin barrier. That's a quality of rosacea as well. SPF, zinc is super anti inflammatory, even though it can give you a white cast. There's so many SPFs now. I'm only a stickler with my acne patients and my pigment patients when it comes to SPF just because there's certain ingredients that I need to complement what I'm doing. But with rosacea, zinc is amazing, and there's so many formulas. I love See Clearly. It's a zinc-based SPF line. It has ferulic acid, which is antioxidant, as well as vitamin D, a strong antioxidant. And then it's a gel, it's occlusive, so it allows whatever water and hydration you've put underneath to really trap in your body to. Um, let's see, what else? Thoughts on radio frequency, neon argon. I mostly use neon and I use it with a mask, which is super unconventional. I use an oxygenating mask by oxygenating boost treatment by bioelements. So if you think of hydrogen peroxide molecule, you think of high frequency and putting those together, your body just really absorbs all of those contents and it's helping with microcirculation. It's helping with just allowing your body to absorb all the nutrients really well. Um, the neon mostly for acne, argon is anti-aging. I have both. I just am more drawn to the neon. And if you have acne prone skin, you can use the neon on dry skin. As for home use, I'd probably recommend it for like if you want some circulation with your scalp to help grow if you have hair loss, or I use it all the time on my men's facials. I'll use the comb and I'll just brush through after a treatment to help with the circulation after I've done like a hydrofacial or diamond glow treatment to really exfoliate all the dead skin and debris that's trapped inside the follicles. And then I'll go through that and it stimulates hair growth. You can do that on your scalp or you can massage it. You don't always need tools to do those things. And then you can use it on breakouts too. You just make sure that, the electrical pulse isn't on too long on the pimple. Otherwise, you're creating a dark mark, but it kills the bacteria as well. So there's that. It's cheap, it's effective. You can use it. Light therapy is the same concept. There's a lot of trash on the market now with that. You can't really go wrong with high frequency. Correct me if I'm wrong, other professionals here. They usually have like a standardized um, megahertz, but with light LED therapy, they're not the same. You will not buy one and think it's the same as the other. I like to use Saluma. I like to use Light Stem. Um, and some other professional ones, but they also have some home care devices as well. What other things do you guys have questions about? I was just about to go get a colonic, and my sister's like, "Are you crazy?" And they canceled on me anyway, so I didn't get it. But I mean, the body is going to do what it's going to do. But I think if you like it, I love it. So if it supports you on that, my friend had a really, really, really bad eczema um, flare up, and she did those for maybe like 3 or 4 months, and her eczema cleared. But I mean, she was also doing lifestyle changes, managing her stress. She cut out alcohol, sugar. She only made food from home. So, there's nuances with it, but I think it can be supportive in certain ways. But most people think it's a cure, and it's really not for things. Just like they think facials are the cure when it's just like you're starting to take the steps of everyday use of your skincare. You're paying money, so you're taking all the steps to start taking care of your skin. It's the same thing with like working out. Like you could eat like trash and say like, "Oh my god, this workout is a thing," but they're all like fine little steps that support your health. But you got to go to someone good, not someone trash. Do you prep the skin weeks before Cosmelon for better results? So I do Cosmelon completely different than how y'all are taught. Why? Because I want to make sure that a patient understands what is happening, why it's happening, and how they're going to sustain results. So when it comes to Cosmelon, you can actually how they create it is you can do the chemical peel the first time, but most people are kind of thrown off with the price, right? So they're like, okay, I'm going to get my quick instant gratification. Oh my God, I'm seeing results within the first 2 weeks. And then they run out of that cream and then they get mad by the 3 month part. They run out of the cream probably by like 2.5 months. And then they get mad maybe at like the 4 month mark that the results are reverting back. When in actuality, Cosmelon is a 6 month program. You are clearing the skin, you are retraining your skin cells to not produce as much pigment and be inflammatory. I always use the synonym of like when you sign up for the military, right? Do everybody go? Does everybody go straight to war? No, they don't. Everybody goes to basic training for a month or whatever, and everybody gets on the same page. So that's the same concept with your skin cells. We're clearing away all damaged skin. You're telling your natural hydrating factors to produce more hydration naturally deep from your dermis, pushing it to the surface. We're pushing up all those different layers of where pigment is at in your epidermis layer to the surface, but you're also re-stimulating those melanocytes to not be as reactive, and that is usually at that like 2.5, 3 month mark. You're already getting really nice results in the beginning. And then you taper off. It's like working out. You got your results, you lost your 10 pounds, then you stop working out and eating right. And then you get it back and then you're mad. So um, to answer your question, the long, the short is pretty much yes, you can prep someone's skin. You're always going to get better results because sometimes people have cemented dead skin from years of no cell renewal or no active use that can come off. So by the time you actually do the peel, it's going on new, fresh skin as opposed to old, damaged skin that's going to peel off anyway. I use the synonym of grass and soil. You have soil, you have grass, and then you have all this dead hay on top, and you're watering the hay, trying to hope that it's going to get to your grass and your soil. But if you take away that hay and you just water the grass and the soil, you're going to get way better results and way faster results. But some people really don't have the time for it. They don't have the budget for, buying more product because they're obviously going to be using more. But you get better results, safer results, especially if you're working on darker Fitzpatrick, which is just more melanated folks. But don't think that darker melanated folks are the only sensitive one. People with Asian backgrounds, they could be really, really light. Same with people with Native American background too. They get really inflamed really quickly, and then the inflammatory process is a problem. Um, What else? Oh, of course, of course. The combo of treatments follow up if you have time, if not using a chemical peel. So if I am working on microneedling on darker skin, I can get deep. You can get up to 3 millimeters. I wouldn't go deeper. Yeah, you can get up to 3 on the cheeks. So when you're doing microneedling, you have to think about the millimeters of fat and tissue on each portion of the face. So usually when they teach you, they're breaking it up. And like the forehead, then they have the cheek, you have the nose, the eye area, and then around the mouth and the chin. Usually the areas that can take the most hit is going to be the cheeks and second, the chin, upper lip. Everywhere else, there's pretty much no fat support. It's just literally cartilage, bone, little bit of fat. So I do the forehead maybe up to 1 millimeter. I do the eye area, maybe 0.75, the orbital rim here. The nose, I do not go more than 0.05. That's when you start to have the petechiae or the people who it looks like a hickey, where it spots and it looks like it's dragged and it's just really bad streaks. So when you're going too strong or you're trying to rush the treatment and go really deep, really fast to get the speckles of blood to know you're in the right depth, you shouldn't do that. You should just do it shallow, do it over and over until you have the consistent erythema of the skin, and then go to the other areas. Um, most patients I've done is about 2. If they really have super thick scarring, it's a 3, but I'm going really, 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 really slow. I love the Dermapen now because you can change the speed and depth, and you wanna make sure that you're going at an appropriate speed because you don't wanna drag. There's so many devices on the market now, so I try and prevent that whole, dragging aspect, but I go really fast. So I do circular movements, I go back and forth, and I do 10 passes per area. So one back and forth movement is 1 pass. And then if I really need to take my time because I notice someone's forehead is super thin and I don't want to, one, cause a streak or petechiae on there in that area, I'll just do small circular motions and then I'll go to another area. And then if this blood starts to like disperse to the surface, then I know that I've done enough passes. Otherwise, if I don't see the blood and I just see erythema or the color hasn't changed, I'll go back and do, circular motions and keep them small. So take your time. I don't know how people get away with doing microneedling in like 5, 10 minutes. How does one know if the sunscreen is working? Can you elaborate on that question? I don't really know. I know when a sunscreen is working because I will be a tint darker within a week and I throw that bad boy away because I've come too far and invested too much money to just be getting my dark spots back again so fast, without a trigger. What's the difference between active and non-active pigmentation? Um, I wouldn't say there is. I don't know if pigmentation is classified that way. I would say active acne and non-active acne. But pigmentation, I guess you can classify it as someone has active acne, like cyclical, like hormonal. And so you never see the pimples, but you see the dark marks every time they come in. Like maybe they come once a month and it's like new marks and new marks. And yes, that's pretty active, but I wouldn't say there is a in between of active and non-active acne. Someone wrote a question in here. What are your thoughts? Oh, you put the high frequency. Lovely. Any other questions? What are your thoughts on guasa for high fits with puffiness? So guasa, you do not have to have. There's no parameters for Fitzpatrick, so anybody can do that type of therapy. Literally, lymphatics supporting their lymphatic system, massaging, depuffing, but you want to do it in the way that it's meant to be done. You don't want to do it just because an influencer is online doing, whatever. You want to make sure that it's supported in the right way. I will probably share one lady afterwards, but it's traditional Chinese medicine, they don't really believe in doing things cold. And a lot of people are doing all these snow globes. I love to do some icing therapy on my acne patients, but with guasa, you want to make sure it's heated. They love to do heated stuff to support the body, the yin, the yang, and all of that. What else? You're welcome. How do you know if it's effective? Because some people say they don't use sunscreen and they have no pigmentation. Well, tell them to come back to you in 10 years. You'll find out. What does the sun do? So you have UVA rays, which think of A as aging. You have UVB rays, which is B as think of burning, and then you have UVC rays, and then we have the visible light, which is like the blue light. Blue light is talking directly to your melanin stimulating hormone, causing more pigmentation. If they're not prone to pigmentation, then by all means, don't use the sunscreen if that's their prerogative. I don't work with people who do not use sunscreen, period. You're canceling out everything I'm doing by not using SPF. The biggest thing is aging. So, aging is people think it's a superficial, aesthetic thing, but it really isn't. It's breaking down at the molecular point your DNA. It's causing mutations, and then it can cause cancer, right? You're breaking down your DNA. You're breaking down the mitochondria, which is basically the battery of your cell to talk and do what it's supposed to and carry out the processes that it's supposed to. When that isn't happening, it's slowing things down. Your cell renewal, the level of hydration your control of oil, the control of collagen. The A rays also break down your dermis and your collagen. So what happens? You start to sag and wrinkle, but you're also expanding your pore size because the pores are also connected to the quality of your collagen, the tightness of your collagen. So when you have those UVA rays, they're kind of opening your pores, and pores are getting bigger and bigger. You'll notice old people who have never worn sunscreen, they'll start to have all these like black dots where the sun hits them here and hits them here, and it's pretty much blackheads. It's naturally the oil that they're producing, but the pore is getting bigger, the dirt is staying in there, and it stays dilated. So you have that. You have the risk of cancer, breaking down of your cellular DNA, mutations, slowing down of your skin, cell function, and yeah, hyperpigmentation. When you go out and you have an active wound, the melanin stimulating hormone is going into overdrive when it's exposed to UV rays and producing darker pigmentation. So that's usually why when they tell you, surgeons always tell you after you get surgery or something, don't expose that wound site to the sun. Avoid it. And so you're not going to heal properly either way. But there are people out there who have normal skin. They shouldn't be giving anybody else who has problematic skin advice, right? Because it's not the same experience. Um, what's the best treatment for hypopigmentation caused by a burn from laser hair? Ooh. Um, See a professional. Don't do anyone at home. Don't do anything at home. If you are a professional, I like to use what's this thing called? I use Latisse with microneedling and then a steroid cream. So microneedle first, use your slip, hyaluronic acid, as Latisse was pretty much like a made for like glaucoma. It's an eye drop for that. And so there's also, correct me if I'm wrong though, I don't remember, but there's also a component of it where it stimulates melanocytes. So most people, they tell you the warning is that it can change your eye color if you don't have brown eyes. Also around your lash line, you'll notice people like start to have like a liner type look or a brown line. So I was taught by this skin of color dermatologist. You can microneedle the skin, and then you apply Latisse drops on top, and it can stimulate more melanin. But you want to make sure that just because there could be the potential of contact dermatitis, you have an anti-inflammatory process after that. So a steroid cream right after is really good for hypopigmentation, but it's probably one of the hardest types of pigmentation to treat. And that doesn't guarantee that it's going to be perfect anyway. But that's one technique that I do. There is also physicians who do transplants. So melanocyte transplants. So they take melanin from one area, poke a hole in your skin, and then they transfer that cell into that new area, and hopefully it produces more melanin. But I've had better results or seen better results with less invasiveness and downtime. But who am I? I'm only an esthetician. There are many dermatologists and plastic surgeons who actually specialize this and who have other treatment protocols for it. Um, what are your tips for treating melasma with microneedling? So you got to be careful with melasma and microneedling. A lot of people warn against it, but you can even get away with RF microneedling with melasma. It just depends on who's doing it, how they're doing it. That's always the case when it comes to treatment. So you can't just say, oh, chemical peels are all bad. It's either who's doing it, what did you do? Same with any type of laser assisted device or things like that. So when it comes to melasma, you have a pigmentary disorder. The exact mechanism of action is unknown, but yes, UV exposure, hormone influxes and imbalances. Um, what do you call it? Heat, certain foods, and then you have the vascular aspect of it, which comes from the sun as well. So when you have the veins and whatnot that are creating and being formed, that it's feeding the melasma, RF microneedling is great with that. Lasers are great with that because it helps to break down that vascular aspect that is pretty much feeding the melasma and making the melasma worse. So I do have a patient right now that I'm working on. Hopefully, she lets me share with you guys. I think she did, but we're waiting for like maybe a couple more sessions. But she pretty much got burned by a laser. I think it was IPL laser, Asian skin type. Um, we ended up clearing her skin from all the burns. And then we figured out that she started running outside. So that exposure, sun exposure, even though she was wearing SPF, but it was her own SPF, started, exacerbating that melasma right where the sun hits her. And then you also have the vascularity aspect as well that started to form. So RF microneedling is great for that. I love to use aerolays because also an aspect to melasma is dermal degeneration. So if your dermis is super weak and aging, it's going to make your melasma worse. So what helps with dermal health? Microneedling, collagen injection, biostimulators, anything that is helping that dermis layer be healthy is good with melasma. But you don't need to go, grind it out and do super deep depths. You just need to create as much microchannels to support and stimulate the skin. Most people think deeper is better, but that's not always the case. Create more microchannels, take your time, things like that. Um, can chemical peels help with seborrheic keratosis, actinic keratosis, DPNs, ZPNs? No. Usually you want to do some type of cauterization and things like that. What speed do you prefer with microneedling? I go medium as long as it's a consistent depth. My skin pan is one speed, so it does its thing. Um, but usually I'll go shallow first and then I'll go a little bit stronger based off of that. What else? Thank you. Dealing with this as an aftermath has been very traumatic. I'll see a professional for a consult. Absolutely. I'm happy to help. If you want to jump in, I'm happy to do a consultation for someone this evening. There's only 9 of us on here, so might as well, if you're open to showing your skin. What are some of the best treatments for, I don't know what IGH is. What are some good TCA cross trainings? Um, Reading the textbooks, chemical peel textbooks. I did a lot of training with Dr. Jason Emmer. What else? I did some abroad. I did some with this Colombian doctor. Um, I did a lot of reading and then I did a lot of trial and error from on myself. Um, but yeah, hello everybody. Any other questions? Thank you, Burn. But yeah, what else can we talk about here? Let's do a case study. Let me find a patient. Let me see. Actually, I'll show you the patient that she told me I could share with you guys, the laser burn. to find her. I hope you guys had a good weekend. You're staying safe. Free Palestine, Sudan, all the fun stuff. All right. Pulling up her picture now. So this is a patient I had. You guys can see pretty much she had IPL burns on her skin, all of the fun stuff. And they didn't want to give her a refund or nothing after burning her skin. This was immediately after. And then it just healed super, super dark. So, I mean, you see one little mark immediately after and you don't stop, that's insanity. So, you guys got to be careful who you go to. This is her pictures. So, my method of treating this was when I got her, it was, hold on, making sure that you guys got all the questions. Hey, Cami. Um, When I got her, it was looking like this. So it was already darkened, it was already settled, they were sporadic and things like that. I think the biggest thing for me was just um, supporting the skin health, so the integrity. So when any like burns or anything happens like that where it's traumatic, there's still an inflammatory process underneath. So it doesn't mean that you need to go out the gate doing a chemical peel to get rid of it because you don't know what's cooking underneath and getting worse. When it comes to hyperpigmentation, it can happen in different layers of your skin. So you have the epidermis, hypodermis, and dermis. Most of your pigmentation is in the epidermis. And it can be from childhood, from trauma, it can be from whatever can happen to your skin and it settles in a certain layer of the epidermis. Where you don't want it to end up is in the hypodermis or dermis, because that's not where melanocytes are stored or where they sit. When that happens, it's usually a type of trauma, which can be lasers and things like that. So when you have this and it's finally settled, you can see how dark it is now compared to that first picture I showed you guys. So what was the protocol? Hydration, it was antioxidants and healing and let her skin like settle down. So we just did maybe like one or two facials. And then the next treatment I did was a Cosmelan type of treatment, Dermamelon. So Dermamelon is a hydroquinone free formula. It has kojic acid, salicylic acid, retinol, high grade salicylic strength, high grade retinol acid or retinol. When you want to get rid of pigmentation, you want to use renewal ingredients. So, renewal means that you want that pigmentation that's sitting in the layer of your epidermis to finally come to the surface. So, that's what retinol and salicylic acid does. So, it's peeling away old damaged skin and new skin is pushed up. Peeling away, pushed up, peeling away, pushed up. And that's the whole idea of why they always kind of pair brightening ingredients with that as opposed to just like bleaching, because it's fading it, but then when you stop using it, all of a sudden it's back, right? So what we did was Dermamelon. So what it did was it had a high strength kojic. You can get one compounded. You can get don't get the black market ones, or you can get an actual like pharmaceutical grade, which was or cosmeceutical grade, which is Dermamelon. And what that allowed was the pigmentation cells to be pushed in deeper as the pigmentation is being pushed up and off. So there was a lot of peeling, there was a lot of burning, there was a lot of redness. Okay, so you guys can see her picture from when she first came in. Let me show you her other side. Um, this was her right side. Okay, all right. Um, and I usually talk people through things. I'm like, hey, you got to really, really trust me on this process because it's not for the weak. I only use this chemical peel for a certain number of people. So When she first got the peel done and it was removed, this is what her how red her skin was. I don't know if you guys can see it with the contrast. Super, super red and inflammatory. Yes, it seems counterintuitive, but the products that we're reusing in conjunction with it wasn't just regular products. So it was an anti-inflammatory and hydrating cleanser, hydrating and anti-inflammatory moisturizer, anti-pigmentation and hydrating uh, SPF that was also tinted. She could not use any other else. She could not dupe nothing. She freaked out. She stopped seeing me for a month. And then, I called her and reached out. I was like, you need to come back. We need to, do your facials. You need to trust me on this process. You've invested too much time, money to not get your skin clear. I promise I will not make you look like that clinic before that did that trauma to you. So this was that picture of her redness, was probably in the month of May, and then she completely stopped using the product. Then I encouraged her to, maybe not see me, but at least start using the product slowly and slowly again. So um, this was her starting to peel and be uncomfortable. So you can see, look at the texture of the skin, the redness, discomfort, all of that fun stuff was not fun, okay? But that's part of the process when it comes to chemical peels sometimes. Just depends on the intensity of the treatment and um, the intensity and what needs to be done. And so this was probably like a month later. So you can see that the whole idea is we are healing the skin. So look at that light reflection of her skin, the hydration, right? When you make healthy skin while also addressing pigmentation and trauma, you're going to respond 10 times better. Yes, the pigmentation was still there, right? You have the streaks. She also has acne and she also has melasma. So it was very, very um, temperamental to treat. I had to treat her as if, she was a delicate baby. That's probably the hardest case, dealing with melasma, which inflames and um, gets pissed off the littlest things. And then you have acne, which is also inflammatory. So it's feeding everything over and over and over. So, yes, I chose one product that was super inflammatory, but everything else needed to be super sedating, hydrating, feeding the skin. So, the whole concept behind UV damage that I was telling you about, she needed to have high quality antioxidants into her routine. She needed to have a really good SPF. So, tinted iron oxide Milan 130 Meso Protect by Meso Aesthetics is what we used. Um, and then we did follow up peels over and over. And then let me get you her skin. No burns. A little bit of melasma under there, but it's like give and take. You got to figure out which is worth it. Let me show you the before again so you guys can see the trauma of the burn, IPL burn, right? And then this is what her skin looks like now. Just a little bit of the vascularity when it comes to no burns, the vascularity when it comes to melasma. So it was always like a teeter totter. She did see me probably for like 7 months, or she took a break after the first initial peel. And then she saw me for like 7 months straight. We took a break because she was just maintaining. Then she came back, um, re-education, and teaching her how to take care of her skin, what her melasma triggers were. So this recent case, when she started seeing me again, she started working out outside, just for mental health and support and, you know, um, working out. But that sun damage, environmental oxidation, people don't realize as well. Environmental oxidation is pretty much what's outside in the air, traps onto your face, breaks down your cellular DNA. So I do not play when it comes to SPF. And then when you get home, wash your face. Don't skip out on it because all of those reactive species just breaks down your collagen. It increases inflammation, more pigmentation, and that's pretty much kind of what happens. She said she was wearing SPF, she said she was wearing a hat, but melasma, you're just super, super sensitive. Same with rosacea. So unfortunately, right now she's working out because she'd rather have clear working out inside. So because she'd rather have clearer skin. I love tretinoin. You can use it, but people are doing on TikTok like Azalea 15% and zero point 0.1 tretinoin at night. That's insanity. And usually, if someone's telling you they're doing that, they're lying. Or unless they have really, 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 really bad acne where it warrants that. Thank you, Sylvia. But you don't need to be up in those numbers. Start low, go from there, 0.025, and then work your way up. If you have sensitivity to tretinoin, you can try a gel encapsulated tret. You can try Tazarac, which is like an emulsifier as well, which is pretty much like a super rich cream based tretinoin. Otherwise, try over the counter retinols. They do the job, get it done. I love Vivant Skincare's retinols. They do a great job. They have different grades. But yeah, do you have any recommendations on body care, like body butters? I think that's personal. I'm all about lotions. I love me some Eucerin because it has just the right amount of like lactic acid, urea in it. So it's exfoliating your skin, but it's also like an emulsifier. So it's super thick and rich, especially during winter time. Even though sometimes I still walk around with ashy ankles. Don't hate me. If you see me, just give me a lotion bottle or something. Mind your business. But other than that, I mean, yeah, I'm not too trippy about it. You can a lot of people ask me about the kojic acid body washes. I love kojic acid for the face. If you want to even your skin tone, kojic acid is amazing, but don't buy just any type of product now because a lot of them are putting in steroids or even hydroquinone. If you're putting a steroid with such an inflammatory brightener, you're thinning out your collagen layer and then you end up with stretch marks and you end up with ochronosis, which is just pigmentation that ends up being in your dermis. It's like a tattoo that you can't get rid of. You have to do laser, pico laser, NDX type of laser to break that down. But yeah, have fun with moisturizers. Um, Use the thicker ones in the winter time. Keep them nice and light in the summertime. You can get oils. If you get dry really fast, you can use body oil washes. They have those where you can use in the shower. It traps things. Use it as like a second wash just to keep things hydrated. You can mix it with moisturizers. But I love acid base and I love regular ones. And then I also love my castile soap. So traditionally in Nigeria, we're closer to the equator. Things are hot as hell, so we always have antibacterial soap or bars. And I love how castile soap, especially during the summertime when you're always sweating, I'm always working out. It really helps to break down all of that sweat and stuff. But don't use it like a daily type of thing because it can be very, very stripping, especially if you're not in an environment that's super tropic and things like that. Um, yeah, tretinoin is for sure the gold standard. What are your thoughts on microneedling keloids? I think the question is it a keloid or is it hypertrophic scar? So keloid is something that grows. So if you get a wound and it's like a little circular and then it starts to grow and go past the perimeter of what it was originally, do not touch it. Do not touch it. Go to the doctor, get a steroid shot so it can kind of calm down because it'll continue to grow if you microneedle it. Microneedling is collagen induction, so you're increasing more collagen. Don't do that. If it's a hypertrophic scar, meaning it looks like a keloid, so it hyper produced collagen, but it has stayed the same size, then you could microneedle it. Microneedle it, you could put a Kenalog shot into it. You can do both microneedle, pour a little bit of a steroid on top, and then just pat it in, and then the stuff will go down. That's usually how I treat hypertrophic scars, especially for people with surgery. Yes, I do microneedling with inflamed acne. I make sure that we already got a protocol at home going on. Usually, when you have inflamed acne, we're using, if you're very dehydrated, I'm using hydrating basics. So, hydrating cleanser, moisturizer, toner, but we're using some type of active to at least bring the inflammation down quickly. So, benzoyl peroxide. If you're really oily, we're getting into the active. So we're either using a low percentage benzoyl peroxide wash, a salicylic acid wash, and then you're doing benzoyl peroxide as well. We'll graduate you to a morning serum. Sometimes the steps don't need to be super long and lengthy, but we need to compound and compound till we find your maintenance, right? So it's like, you're dieting and dieting until you find the body you want, or like you're at the body size that you want, and then that's your maintenance. So same thing with acne. Then that's when I tell my patients, like, hey, you can start to venture out once you stay clear. So we clear you and you stay clear for 3 or 4 months, then you can venture out, but try and stay within this family of ingredients. My patients don't need to see me all the time, especially when I get them clear. I see them either once a year, quarterly, or there's still people that love to see me every month. It's not mandatory. It's definitely not mandatory for you to come back or do facials, but for sure, when I'm dealing with active breakouts or inflamed breakouts, that's what I use. For microneedling purposes, I do Heal MD, which is a CBD based oil. And the oil is, I believe, I forgot what the oil base is, but CBD is anti-inflammatory. You can go deeper with it, 1.5 mm into the skin, especially on the cheeks, not obviously the forehead and the center of the face, but you go in, microneedle that in. Otherwise, and then I pretty much drain the inflamed breakout. So it's not like inflamed all over the face where they're uncomfortable to even wash their face. It's rude and mean to do microneedling. If they have, some residual left, but you want to create more progress and maybe clear some breakouts away, especially when they have like a breakout in the same area. So mine used to be right here and it would be dormant and then it would come back when I'd have a trigger. And so what I've learned is that microneedling is great for those ones because pretty much it's an exploded follicle. And so you'll have a seed inside anytime you have a breakout that, or you have a trigger that inflames it, it comes back up and erupts and erupts. And that exploded follicle is all damaged collagen. So if you microneedle and break all of this damaged collagen up, your body clears it away, the immune system reabsorbs it, and then it just clears for new collagen to form. And I promise you that you won't have that breakout in that area over and over again anymore. But um, I love doing microneedling on inflamed breakouts with Heal MD. I do it with regular hyaluronic acid, sterile. I do not use what I use or what patients are using at home to microneedle at all. And then I do a lot of peels. So I'll do TCA with microneedling. I'll do azelaic acid or combination peels. You got to be careful because some peels you kind of want it to stay superficial and not too deep. Like I wouldn't necessarily do salicylic with microneedling, more so TCA because it can go deeper down and self-neutralize. That's the most important thing, self-neutralize. Because when you're doing a chemical peel, what's happening is it is like, what's the word? Denaturing your skin cells and loosening them up. And then that's when you have that peeling process in a few days. So if you do a chemical peel and then go in microneedle, you'll see that the skin starts to like ball up, almost like a gommage, and all the dead skin starts to like separate. That's why I prefer microneedling and then a chemical peel on top. It might be spicy because of the neuroreceptors that I told you about with chemical peels. It literally deactivates the numbing, but let them be comfortable. Numb them, do the microneedling, and then obviously when the numbing's wearing off, they feel the light sunburn sensation. But when you do the peel, it cuts that time in half a little bit, but they are expecting that numbing to wear off anyway. So TCA with microneedling is amazing because it's self-neutralizing. And then you don't want to do glycolic because that molecule is so fast. You will just have hot spots and complications. Unless it's like a blended formula where you think it's stable enough, then by all means do it. Recommendations for kojic acid products for maintenance. Yeah, on my website, check it out. I definitely have amazing products. I love kojic acid. I have a maintenance cream by C Mill. Like I said earlier, Dermamelon that I showed you guys that patient's case, that's what I used to heal her skin. It was kojic acid. But it was kojic acid with retinol. All of these do. Vivant Skincare, the Dermagel, the Exfoliate Forte, they all have kojic acid in it. What else has kojic acid? Some new products that I'll be coming out with. Can you get PIH for microneedling? Absolutely. If you do, like for example, a chemical peel like DSE Mass 2 Deep, which is an inflammatory peel, past 0.75, you will get PIH for sure. Um, if you are dragging it on their skin, um, you can get PIH. If you're infusing a serum that shouldn't be into the skin, you can get contact dermatitis, and contact dermatitis causes inflammation, and they'll be itching really, really, really bad, and that's an inflammatory process, and then it'll heal darker. A lot of people do microneedling with Cosmolon or microneedling with Rev Skin and Light and Peel. Pretty much, it's a time release. Who doesn't know? People who don't know what those are, Cosmolon and Enlighten Peel are pretty much hydroquinone retinol based peels, but they're in the mask form. So when you put it on as a mask, you're leaving it on for 8 to 12 hours. And pretty much you are allowing a time release action to happen. But when you create microchannels into the skin, you are cutting that time in half a little bit, but it's allowing it to go a little bit deeper. But sometimes people's skin can't handle that trauma. So I've seen people with burns off of that. I definitely was a model for someone who did that, and they definitely burned me. Um, painful itchy, stay the same size. What other questions do you guys got? Anyone want a free consultation? You have to jump on the call though. What do you recommend for large pores? So if you have large pores, you have to decide, or you have to figure out if it is a dilated pore from acne and oily skin, or it's just literally larger pores. You have to control your oils. So when it comes to skin health, that's a component. So your hydration levels, the quality of your oil and water levels, um, your texture, your pigmentation, the quality of your collagen. So the quality of your oil impacts your pores because if you're overproducing oil to kind of compensate for the lack of water in the skin, you're going to have larger pores because it's constantly inundated with impactions, right? So, what I like to recommend for people, you can do if you're sensitive skin, you're not used to actives, mandelic acid. If you're a G, you can handle it. You can handle some dryness, some flakiness when you first start. Salicylic acid is probably one of my favorites for that. And you get results really quickly. I use salicylic acid on all of my rosacea patients, and they usually have enlarged pores too, especially when you get to the higher grades. What else for large pores? Making sure you're wearing sunblock. Like I said earlier in this call, UVA rays break down your collagen. The collagen starts to drop and droop, and then your pores start to open and not open. They don't open and close, but the collagen that supports it, think of it as like the base of the bed, and then the mattress starts to break down, and so the pore starts to dilate and dilate. So managing your oil production is going to minimize your pores. You can do everything. You can even do non-invasive stuff like micro injections or stamping of Botox that controls your skin when you're going super superficial. Um, a lot of Korean clinics do that, and I'm very fascinated and love to do it as well. Do you allow clients to use drugstore products and cleansers like CeraVe? Hell no. No, wait. I hate Cetaphil. CeraVe is pretty decent, but I can't be mad at people's budget. I can't be mad at people's lifestyle. I got to be able to work with it. But acne folks, I do not budge. And when you're new to me and I'm addressing and correcting something, you can only use my products because I know the mechanism of action. I know the quality of the ingredients. I know when you're going to get a reaction. I know when you're going to get change to your skin. And I know how it's going to influence. Usually, people who are not really seeing results or anything like that, I let them slide and getting away with other stuff, and that's usually the problem. So, over the counter products, I do not use unless it's like an OG client. We cleared her acne, but we're maintaining quarterly or whatever. Then, yeah, get fancy, work with your budget, or people like skincare is sometimes therapy for some people too. So then I'll let them, kind of do some other things, but at least let me have one product, which is like their serum or say their SPF. But I hate Cetaphil. Think of it as cereal. There's no nutritional value to it. CeraVe is, I used to use CeraVe before I got into this industry. They have good basics. They have a cleansing or a hydrating SPF, a good moisturizer at night, but they're light lotions. So there isn't that much versatility. And then when you get to the higher stuff like La Roche Posay, which is a really good over the counter product, and they actually have adapalene, which is a prescription strength or retinol. Um, it costs as much as the products I'm gonna give you, so yeah. I like to control my outcomes with all the controllable factors that I can control, so that is their skincare and the treatment, as opposed to, like, their diet and, their quality of life and lifestyle and stuff like that. When I can control my stuff, then I know what's working and what's not working. So as an esthetician, I advise that as well. I had microneedling at zero point 0.5 and I have PAH. I would love for you to jump on and share me your experience because it definitely, I could only hear what you have to say about it, but I can't imagine doing zero point 0.5 and getting PIH unless they used no slip. Think of microneedling and a water balloon. You poke all the holes inside the water balloon and water starts seeping out of the water or the balloon, right? Water is evaporating from your skin. It's the same concept. So if you're not putting water to replenish into the skin, you're going to trick your body into an inflammatory process because we're already tricking your skin into micro injuries to repair itself. So if you're not feeding it what it needs while it's being traumatized, your body's reaction is going to be PIH. So maybe it's how they dragged it, what they didn't use, or what they used. But I always tell people like the complications with these serums that they microneedle into your skin is serious. It's a really serious thing. You can get microgranulomas, which is just like if you think of like your serum, some of them have fragrances and fluff in it. So imagine that inside your body, and then your body thinks it's a foreign material, starts encapsulating it and fighting it. And then you have all these like bumps that are inside of your skin that you can't get out. You have to get it surgically removed. And then there's sometimes where it's like you're putting ingredients into your skin, you end up getting contact dermatitis, and then you get inflamed and things like that. Or it could have been from Moxie laser. I've had about 2 months prior. Yeah, it could be. Moxie's good, but there's some good tranexamic acid products. So, tranexamic acid is a brightening agent. I also used to take it, like I said, I let someone get away with something on me, ended up burn on my body. Doing the training, that's why I do not let nobody touch my face. I let no one touch my body. I just do my own treatments now. So I um I ended up getting on tranexamic acid oral. So tranexamic acid and the fern leaf, which is what is that? It's like SPF in a vitamin form. Really supports your body into not producing as much melanin. Same with tranexamic acid. However, it's used in emergencies for clotting and things like that. So you run the risk if like someone is on hormone replacement therapy. Most women, not most women, but some women are in menopause on hormone replacement. Same with people on contraceptive and things like that. You want to be careful because it can cause more and more clots. So 650 milligrams tranexamic acid is amazing because it helps support like pigmentation and evening your skin tone and allowing the processes of whatever treatment or products you're using to support. Same with topicals. The topicals alone of tranexamic acid is a lie. It's a fraud. Don't do it because it works better in synergy as opposed to an ingredient by itself. It does a little bit with brightening, but I would say vitamin C does more brightening than tranexamic acid topical alone. But you'll see it in most brightening formulas, especially with melasma, because tranexamic acid, which I told you has that blood factor to it, also helps to minimize that vascularity aspect of melasma growth as well. So long story short, I don't really recommend a tranexamic acid product. I rather microneedle something that into your skin or do micro injections of it or have my medical director give you oral prescription for it. But topical products, I don't usually have. Maybe you can check my website, but usually the star ingredient is like licorice root, hydroquinone, kojic acid, things like that. They're going to be of higher quality. Um, you use Cetaphil. It's all good. It's all good. If it works for you, I love it. But for acne clients, it's a no-no. Okay, yes. Any other questions? The tranexamic acid affect PCOS. It depends. There's so many types, subtypes of PCOS. Yes, Helioplex, that's what it's called, or Heliocare. Yeah, so it's a fern, it's a water fern. It helps to give you like an internal SPF. But remember, all of these things by itself is not a magic pill, especially think of skincare like it's like what you do every day. It's your cleanser, it's your moisturizer, it's your serum, it's your SPF, it's your toner, it's, you avoiding your triggers, things like that. My favorite supplements for skincare or skin health is omega fatty acids. Omega fatty acids are huge. They are, think of it as a fire extinguisher for any inflammatory process through your body. I love it. I'm under high amount of stress. Stress equates to inflammation. It also equates to higher levels of sometimes your hormone receptors that produce more oil production and produce more dead skin cell buildup. Yeah, I love it because systemically it helps with that. It also helped too with my gut issues that I was dealing. That was a big part of my acne journey. You have your mucosal membrane of your stomach, which is mucus, right? Like think of inside of your mouth. It's encompasses a phospholipid bilayer, which has lipids and oils. And so omega fatty acids helps to replenish that, strengthen that, so it's not acidic or breaks down or erupts and causes stomach issues where you can't tolerate certain foods. You have deficiencies of vitamins and certain things, you can't absorb things, so it really thickens that. It really helps you with regulating your oil and water production in your skin, so your oil levels are at a good amount, so you're not overproducing oil. But the biggest thing I think is its anti-inflammatory process. Um, what else for skin health? Everybody's different, but you can get away with omega fatty acids for anything. It helps with your brain health, your eyes, your heart, brings down cardiovascular disease disorders, um, helps with hydration for not only your skin, but the rest of your face skin, but the rest of your body as well. Um, what else do I take? I take a multivitamin. I take digestive enzymes or probiotics, omega fatty acids. Um, I take DIM when I'm under higher stress. So DIM is pretty much a precursor to DHT, and so when you have higher levels of that, your acne can exacerbate, or higher stress and things like that. So it's basically crucifix vegetables. Think of leafy greens. So when you have leafy greens and DIM, pretty much what DIM does is it acts like a Pac-Man to kind of eat away all the excess estrogen and testosterone that's in your system, that's causing you to be more stressed, produce more breakouts, and things like that. So some people, most of my acne patients are on it. Um, or some people taper down to the point where maybe they take it like just in a 2-week period of the month, things like that. I just do it when I'm under stress, and crucifix vegetables have high antioxidants in it. I started taking vitamin D and K. Um, and then, of course, glutathione. So omega fatty acids and probably glutathione is my favorite thing that you can kind of do self-sufficiently. Just make sure you're getting a good source of omega fatty acids, because if they're rancid and you wouldn't even know, you will find out because all of a sudden your skin is erupting with crazy breakouts, or you just don't feel like yourself. and things like that. Um, I missed my services from you, so use your ex even now. Oh, I'm so glad. Yeah, if you guys have any tips and tricks that you'd like to share with these people, by all means share. How do I schedule a free consultation? I do not do free consultations, girl. I'm doing a free consultation right now, so if anyone wants to jump on the call so you can see how I do my consultations, you let me know so I can just add you in. How about the men getting on testosterone to build muscle but causing breakouts? Then they got to figure it out. It's like the same ones with steroids. Do you want the muscle and the acne, or find an alternative? I'm like, dude, go take some creatine and take some other stuff. But there are some men who have comorbidities, obesity, so their testosterone is low, so they get on testosterone, they lose weight, and it ends up being so it's like risk and benefits that they have to talk over with like whoever is overseeing those treatments. So I always say, hey, your doctor or whoever you're seeing for X, Y, and Z supersedes what I'm saying, but I'm happy to support whatever program that they have you on. You got to just make sure that we're kind of fighting against a brick wall in a sense. If you know that testosterone is the actual trigger, sometimes it can contribute a little bit, but um, help them control other controllable factors. And then if it's still a problem, then you just say, like, hey, I don't think we can work together with this because it's not going to go anywhere. But you can control it with like a benzoyl peroxide body wash. You can do like 10%. I don't recommend 10% on the face, but 10% body wash. You can have them do stuff that support their elimination processes, things like that. Yes, glutathione. I love Quicksilver. It's a drop it's liposomal bioavailable dropper that you can take in the mouth. And I have some of my acne patients on that too, and I take it too. Because when you get constipated and stuff like that, your intestines get backed up, liver isn't as optimal. You start noticing like stuff with your body, your skin. And so when I notice stuff starting to slow down, I take glutathione. I'm just super in tune with my body. Oh, thank you, Alexis. I would love for you to jump on if you're available and give some tips and tricks. Omega-3 alternatives for vegans. So Dr. Amen, he has some omega-3 alternatives. Same with integrative therapeutics, but it is a liquid form, and it tastes nasty. For those who are vegan or some people who can't take like gelatin and things like that, I recommend them those alternatives. You just have to take more because you want to make sure you're getting the right DHA. I'm at my son's 18th birthday party. Oh, happy birthday. You got to make sure that you're having the right ratio of EPA, DHA, taking at least the recommended amount of milligrams, which is usually 1,000, things like that. What are your thoughts on electrolysis? I think it's great. Some people really need it, especially if they have PCOS or things like that. And laser and stuff is still not working. But being hormonal beings, you can still kind of, I have some patients still break through with even electrolysis, but you just got to be careful because it can create scar tissue from the heated needle going inside of the hair follicle. Um, and stimulating trauma. So usually I pair it with get them on like a retinol to help with cell renewal and thin out that collagen that's thickened. And then also microneedling to kind of like break that down to stuff that helps with texture. Hi, sent you DM. Hope you can check it out. Yeah, ask a question. I'm happy to help. All right, I've been talking my head off. Any other questions you guys have? Thoughts on micro ingredient supplements? Like what? Um, I can't think of anything. So, what I usually like, say, for example, what I usually have my patients who are on GLP-1s do for like micronutrients is, let's see here. You can do vitamins like multivitamins that have micronutrients in it. You can do I don't recommend the B vitamins, nothing like that. I don't know what you mean, but let me know. Again, I'm happy to consult someone who would love to jump on the call and have any skin questions. I'm happy to answer, and we'll end it there. And I'll also send you some free products to try too. But if you guys have no other questions, it was great meeting and seeing you all. I'm located in Rancho Cucamonga and Beverly Hills. I'm off of Camden in LA, and then I'm off of 4th and Milliken in Rancho Cucamonga. Okay, skin products during this weather. So I would describe this, specify this weather because it just started raining. Okay, I'll take you as the jump on. So we'll do that. Give me like 5 minutes. Let me answer this question about the weather. Sarah, so you asked about this weather. So if it's rainy and cold, I would recommend growth factors. Use a thicker moisturizer to make sure like the hydration levels in your skin are good. Peptides. Yeah, I'm in Beverly Hills now. Um, if it depends on your skin too. So if you have like say oily, acne prone skin, stick with a gentle cleanser, a rich moisturizer, and maybe a good strong retinol. So it's going to still control your oil, renew, and bring out your natural hydrating factors, but you're also supplementing and supporting it with a gentle hydrating cleanser, a toner to kind of like wipe away the dead skin cells that the retinol may form, and then a rich moisturizer that's actually going to quench the skin. If you are dehydrated, you need to use like peptide based ingredients in every step. That is from toner all the way up to like your serums and your moisturizers. And you can do the same concept if you are dry and dehydrated. You can use cream cleansers. I use cream cleansers when I'm using a really, really high retinol. I have to use higher retinols when I'm under more stress because stress induces more oil buildup and more dead skin cell buildup. That's a quality of acne. You're building up oil faster than the normal person. You're building up dead skin cells faster than a normal person. So you have to regulate that cycle back to homeostasis and whatever that looks like. And then as we age, that process of renewing those skin cells off starts to slow down. So what ends up happening is it impacts your pores and you get more and more clogged. So say if you're a dry person, use a cream cleanser. You can use a hydrating toner. You can use hyaluronic acid and a cream cleanser. Trap in water and then trap in cream. You don't want to use water because the water will evaporate off the skin if there's no water in the air. So hyaluronic acid is better for oilier skin um, by itself, but in conjunction with creams, it's really good for drier skin. Um, what else? Just keep balance with your exfoliation. If your skin is too sensitive, I just say start with a washcloth, but get a good moisturizer that's super healing, and then make sure your cleanser is of quality of what is going on. I cycle between four. I have a really strong chemical one. I have a moderate, and then I have like two mild ones. So it just depends on like what my body is going through, and then also the weather change. So I always tell people have two cleansers, one for summer, one for winter, and then you may interchange between the two throughout the year. What products should I use for maintenance after treating melasma? Um, Always have a hydroquinone formula and always have a non-hydroquinone formula. So you have to take breaks with hydroquinone. You can't use that forever. But a hydroquinone formula could be kojic acid. It could be, you can use, what is it, by Skin Medica, Latera 2.0. You can use um, Cosmelon, their non-HQ formula. You can use CML maintenance. You can use like hyaluronic acid based serums that have like complexes, like brightening complexes like those. And then sometimes I have a lot of patients when I'm working with their dermatologist, they're on HQ throughout the whole year and ongoing. But as long as you are supervised and this doctor is saying it's okay and you're going to go see them and things like that, and the percentage is right, maybe you take breaks on the weekends, or maybe you take 1 week breaks every month, by all means, of course, they're going to supersede what I have to say. And I don't have an opinion on that whatsoever. So as long as your skin is healthy and you aren't abusing things, by all means. Like the glutathione, creatine, magnesium. Yeah, micro ingredients is a brand. Oh, okay. Yeah, I love glutathione. I love creatine. I created many posts about this. Check out my Instagram and also check out my blog posts on creatine for brain health, for skin health, for metabolic health, for muscle health. Superb. You just got to be careful, especially if you run into issues with your kidneys or have predispositions to that from, familial people in your family. You just need to be careful with creatine. You have to support it with enough water. Okay. Magnesium, I forgot to tell you that. I take magnesium every night. It's almost like a nature Xanax, and it also helps with your digestive health. It helps with motility, so you're not as constipated, things like that. Glutathione is probably the most elite antioxidant on the earth, besides superoxide dismutase, but you naturally produce glutathione, so it supports your natural detox system and your liver completely. Yeah, I've never heard of Micro Ingredients as the brand. Thank you. Looking forward to my follow up. Yes, I will see you. I love CML. Their cold peel is okay. It's similar to DSE, but cold peel is, um, I would probably call it second. I am going to add someone on and then we will end this live. So let's see if she agrees. It depends. I would look them up both up and see which one benefits you the best, because some people end up having diarrhea with certain magnesiums. So figure out what your goal is. Mine was anti-stress because I'm already taking like probiotics and things for my digestive health and things like that. So mine was more for stress. And then there's certain ones that pass the blood-brain barrier too, which is the ones I take. So yes. Who wants to jump on this call? Let me know. I don't know if she's going to answer. Otherwise, I'm going to end this. Any other questions you guys may have? Professionals, patients? All right, she's unavailable. Alrighty. It was great to see you guys. Hopefully, I get to find time again and do this from school. But please feel free. You can DM me. You could comment on my stuff. Whatever you want to do, comment on my stories. I'll try and find the time to answer. But great seeing you all and hope you guys have a good night. Will do, will do.